Dieu Tout-Puissant, comment le considère tout l'univers créé par ton pouvoir. Le ciel d'azur,
As young moms, Susan and I always talked about wanting to do a medical trip, and our kids were never at the right age, and it was so hard to find. And then Emily Hitron from Christ Church in Needham asked Susan if she would like to go to Haiti, and Susan called me, and my family was supportive, and so we started going back, years ago. And so I've always wanted to bring BC students. I used to bring alums and nurse practitioner students like randomly over the years that could came with us on the trip in March. And then Susan Gennaro, the Dean of the School of Nursing, has been really supported and has funded the past 3 CSONs in Haiti. The earthquake, despite the sadness of the deaths and everything and the rubble that Leogane was the epicenter of the earthquake, there has been so many NGOs, Japan, Canada, Korea, the United States, all of these countries have helped to provide an infrastructure and hire Haitians to help, teach them for sustainability. And I think our long-term job is to not have a job here in Haiti. We really want to see the sickest villages and people that haven't had care in maybe a year, because we are lucky to have so many resources with nursing students, nurse practitioner students, and nurse practitioners that can care, and we bring like $10,000 in medications. So we feel blessed to have this great fortune, so we really want to see the sickest people and not necessarily the people that always get seen. I've really been working with all of the girls, the nursing students, to sort of look at the village and assess that. It's a community health way to look at the village and set up triage, the pharmacy, and where the providers are going to be. So they've really become, I helped them in the beginning, but in the past few days they've really done that themselves. So my hope is that they realize that they can affect change in this world in just like little things, that they always give back every part of their life, that even if it's an hour a month when they're working and busy, that they live their lives for others. They bring their children and their families up to take care of other people and to be aware. I see phenomenal teamwork. They're able to look at communities, advocate for people in this world, and we talk about their communities at home, how they can advocate in different ways. Basically, a community is the same. It's people and how they live their life and how they get their resources, and accessibility for community health and for nurses. A lot is to healthcare and a good way of life. So the Children's Nutrition Program has been around here since I've been coming to Haiti, and it's based on the Hearth model, which looks at a village and a healthy mom. And they come in, and it's sort of like playgroup. They have like 10 moms that come in, and this mother teaches how they use the food from the community. So nothing is brought in. The model is that the mothers teach the other moms how to cook and feed their kids with what's in their village, with what's there. So the Children's Nutrition Program goes in. Malnutrition 10 years ago was a huge problem in Haiti, and it was shortly after the earthquake. But they weigh the kids on the scales, the hanging scales. mums or whoever, grandmothers, have charts that they bring in, just sort of like the pediatricians have at home, growth charts and weight charts, and they come in. If their arm circumference or their weight is below the normal level, they have different levels, and they give them plumpy nut, or they put them on this thick porridge that is really high in nutrition. And I'm not sure we can go by statistics, but Bob's at the guest house said that malnutrition here in Legon is down to almost 3%. Not quite sure that's accurate, because I think we saw a little more this year than I saw last year, but it's like an amazing program and an amazing model. You know, we saw elephantitis yesterday, which is filariasis, and Bill Gates and the University of Notre Dame have an unbelievable program where they go to every village in October and give a pill to eradicate it, and it's been unbelievable, you know, that we hardly see that, so that's very hopeful. We have to get the Haitian people to take control and you know, give them, we hire the translators and they see work and they see hope, to have the people, you know, take care of themselves. And I think that's our long-term goal, is to you know, but everybody that you talk to, it's the people that have to make the decision to do this for themselves. So we're always trying to do that, whether it's control over their health or their blood pressure, women for their own, in their relationships, to take control over their own bodies and everything, to give people, you know, to take control. This has been like a bonus. I've been teaching class and bringing students from sort of on their community health rotation out to the villages for years. Some years it works out with communication, and some years it doesn't. Julia Roboff this year, she's now a visiting clinical professor there, agreed to teach pathophysiology and has worked for hours and hours providing slides with some support from Boston College faculty, and she prepared lectures for them, and she and a bunch of the students have gone down almost every day and taught there. A few of the girls have really realized their passion in nursing, and their long-term goal is to teach. I mean, and to see these young women come alive is just like phenomenal to me.
Hello, Boston College. Thank you to sending your nurses in Haiti to learn us. So between the class, I learned much things about my immunity system. Today I learned about the transfusion, the problems we can have with the transfusion. But I'm very happy. I think also my classmates are very happy. So I thank you again.
And has it become easier for me to talk to you and for you to talk to me?
Yeah, I think it's better.
Yeah, I mean, like, it's hard to teach this stuff, like, anyway. It's hard to learn in the same language, let alone, like, in a different language. And I think that even the translators, like, their English, like, knowing what did we say, like, what a lymphocyte is, like, in English, like, most people don't even know what that is, like, so it's hard to translate that into a different language while also holding the meaning, the significance of it across the language.
And then as far as teaching goes, you want the students to know that the students are understanding what you're teaching them, so you ask them for the information back. But them trying to explain it in a different language, they don't necessarily have all the words that they can explain it in a way that's both understandable to them and actually what it is. So I think the combination of the two, between Creole and French and English, and trying to...
Right, because French is their second language.
Exactly.
Creole, so English is very, very, you know, there's a lot going on. They're doing very well, though, I think
They're teaching us a lot in terms of, in order to explain things simply and concisely, you have to know it.
Yeah.
I think it's easier to rely on the scientific language, and it requires such a deeper level of understanding to parse it down and just talk about it in more simple terms.
And get the main
they're teaching me just as much as you're supposed to be teaching them.
Yeah.
You know, we came down here, we really did not know what, you know, the setup was going to be, you know, what level the students were going to be.
what the language, exchange was going to be. And through the first day, we've been able to really quickly shift gears with the help of these wonderful students, shift gears and really get a program together that's going to be efficient and successful for them.
We're so lucky and fortunate, and we spend so much time in the big Boston hospitals and with the newest technologies, and to kind of break away from that and come down to Haiti and take care of people who really need this care and can't necessarily always afford it or have access to it. And I feel like I've done so much more active listening and doing and participating, and I feel like my own skills have grown just in this short week.
It's Friday, it's our last clinical day, and just had one of the most amazing experiences I've had here. Liz and Valerie were out on a walk, and they found a pregnant woman lying in front of her home, and she didn't have money to come to the clinic, but we brought her here, and she was due in I think 6 days. So we checked to see that everything was going to be okay. We gave her everything she needed to have her baby in her home, which is just up the road over here. So when we were done, a few of us walked her back to her home, and it was just such an amazing example of what the community health is all about. Like finding someone in the community, caring for them, teaching them, and bringing them home, and seeing the resources that they have available to them there. And it was wonderful. So I just wanted to say thank you so much for such an amazing experience in Haiti this whole week, and I know I will remember this pregnant woman for the rest of my life.
This entire week has been such an amazing experience for me. I know that watching you and all the nurse practitioners just be so compassionate towards everybody and so patient with us, I know that is just going to help me be a better nurse as soon as I graduate. Just shows me what I want to be like when I'm teaching others and when I'm caring for patients. And you're just such an inspiration to me and to all of us. I know personally, I just watch you, and I'm getting so emotional, but you have so much love for these people, and they just adore you. You walk into a room and the kids just run up to you, and it's sorry, it's just so sweet, and it's just exactly what I want to be like when I'm your age.
I felt as though yesterday at the orphanage, when I was holding on to this girl who was just, the people at the orphanage didn't even know how old she was, so I'm guessing she was anywhere between 1 and 2, but she couldn't walk because she was so malnourished, and I found her sitting cross-legged on one of the beds by herself, and it just broke my heart seeing her. Her arms and her legs were probably just a few fingers in diameter, and she didn't even say a word. I tried to get her to smile. I tried to throw her up in the air, and all kids like that, but she was just so sad and so tired that it broke my heart, and all I wanted to do was just take her home and just feed her until she couldn't eat anymore. And I think I haven't stopped thinking about that, and I really wish that there was something I could do for her, and then for all the malnourished people we've seen here. That I think is what touched me the most.
My most pivotal moment of the week was caring for an elderly man who was 88 years old, who was brought in by his daughter
she had explained to us that he had been going quote-unquote crazy, and we discovered that it was actually probably an early onset dementia or Alzheimer's. And during our interview, he started to vomit and, sort of just crumbled, and it was really emotional for me, but also explained to me why I need to go into this role, and more importantly, to be there for the patient and for the family as well. Seeing Donna teach the daughter about how her mother also has Alzheimer's, my grandfather has Alzheimer's, and it's a normal aging process and it's very difficult to go through, but just giving people support, if that means medical or just holding them like Amy did for that man, giving him rehydration and then letting her know that he's on the way down, but that his daughter is doing all that she can, and that was my most touching moment of the week.
Name and phone number for us, and I want to write down instructions.
Which one? Both or
just her name and phone number.
And the baby's name.
The baby's name and date of birth. Okay. She's failure to thrive, and we actually think that she has a central defect of some sort. What we're going to do is we're going to send her to the hospital that we've been staying at, and then they're probably going to refer her to Port-au-Prince to see a cardiologist who maybe will be able to operate and take care of things.
And we as a group are committed to paying for this, to follow her through. So we're getting her cell phone number, and we'll talk to Dr. Gladys back at the hospital, and at home we would never see this because we would not have gotten this far. So kind of like a referral to Children's as best we can.
Right.
All right. Good job. Thank you.
You really have become so many people's mentor, including myself. And when someone has a mentor and they see that they're believed in, that they're supported, they can really flourish, I think. And you've kind of changed the way that I look at the world, and also the way that so many of these girls look to the world. I hope that they, like me, understand the importance of passing this on to someone else. And just thank you.
Just seeing people, a lot of them sharing their experiences post the earthquake and what happened to them and how many of them have lost so many loved ones, and for the fact that we're coming here and helping them with whatever little ailments or diseases that they need, and having Donna there every step of the way telling us, like, you can do it, motivating us to be independent, and answering every little question from a skin infection to a pelvic disease or disorder. It's all about, I want the students to learn, and you teach one student and another student teaches another student, and it's just a rippling effect, that just a pool of giving that just keeps on going and going. And I'm just so blessed to be a part of this opportunity. This is an experience that I will forever hold in my heart.
So I came in not really knowing what to expect. I've worked abroad quite a lot, mostly as a public health person and never as a provider, and so I have this renewed conflict that I have every time I go out to work in the developing world about whether it's better to work on the bigger problems or to treat the people right there. And so I think it's good that it's helping to keep me mindful of what I'm doing and having a purpose in everything I do. And I'm still struggling with the right way, I guess, to be able to provide for people and have it be sustainable. And I guess just being thought-provoking is always a positive thing, so I'm still kind of working that out in my mind, but overall it was a really wonderful experience, and so I'm glad that I had the opportunity to be here.
It really kind of brought home to me that you need to have something later in life that you're very passionate about, and more than just your career, more than just your family, like, this is yours, like, it's all yours, and it makes you so happy. And I feel like it's just really important to have that in your life, and it's really inspired me to go forward in life, especially in a time that all people are thinking about are their jobs and, like, what's the next 2 years going to bring. And it just kind of made me realize I need to not only focus on that, but something that's going to give back and really something that's going to be for me. So
I have a quote from Dr. Martin Luther King about service that always makes me think of Donna. So it is, everybody can be great because anybody can serve. You don't have to have a college degree to serve. You don't have to make your subject and verb agree to serve. You only need a heart full of grace, a soul generated by love, and you can be that servant. And Donna is that servant every day of her life in everything that she does, and it's experienced for those of us who come along on her journey to Haiti, and it's a tremendous gift that she gives that keeps on giving.
When you try your best but you don't succeed, when you get what you want but not what you need, when you feel so tired but you can't sleep, stuck in rivers, and the tears come streaming down your face, when you lose something you can't replace, when you love someone but it goes to waste, could it be worse? Lights will guide you home and ignite your bones, and I will try to fix you. Above or down below, when you're too in love to let it go, but if you never try you'll never know just what you were. Lights will guide you home and ignite your bones, and I will try